Wonderful. Okay, tell me a little bit about your history with charities.
I had a wonderful opportunity about 10 years ago to have the acquaintance of the leadership of the charities and understand the vision that they brought forward, Michael Ginn and Carla Cooper, and then subsequently Mr. Fine. What I found for me personally, it was an experience that really made what I thought we are here for very contemporary. And what I'm trying to say is that the charities made beliefs in terms of taking care of others, understanding the wellness of the body, mind, and spirit, very, very realistic, not only in my life, but in the lives of the patients that we serve. And so that opportunity became a reality in that the charities became very generous to Baylor College of Medicine and specifically to the clinics that I run, the teen health clinics. I guess in summary, there are no coincidences in life, and the charities being in my life made a big difference for the patients that we serve as well as the patients in Harris County.
Can you talk a little bit about the research-informed grant making?
Research-informed grant making to me is a wonderful experience because in an academic center, we always want to choose those issues that are not only cost-effective, but we know work. And so informed grant making not only finds a worthy cause, but a cause that is cost-effective. We would all like to help everyone, or what I would call the least of our brethren. But there are some people who, with just a little bit of wind under their wings, we can make a huge, huge impact on their lives and the lives around them. Informed grant making provides the data to make the best choices in terms of how to change the world and specifically individuals' lives. There are not enough resources to do everything, but the resources that are generated by the charities and specifically their process allows us to be very effective.
Great. Let's switch over to the history with the teen clinic and were we already funding before Gulfton?
You know, it was a very interesting experience. I'll never forget, I got a call from the leadership saying Mr. Ginn had seen in some of his volunteer work a huge number of pregnant teenagers at a certain high school, and that from his point of view, there was an opportunity for an intervention. Young women, for a variety of reasons, were not able to continue their education, and were there some opportunities on the school campus to make a difference? And so we talked a little bit about what those opportunities would be, and based on those opportunities, I had the privilege of applying for funding for a clinic at the high school, which became a very successful initiative. It's at the Lee High School, and we are the medical home of over half of those kids. We do know several things. We reduced the number of pregnancies on the campus. More kids are graduating. The rates of vaccinations and immunizations have gone up. And we have actually avoided some very, very bad outcomes by having medicine applied in a prophylactic or preventive manner. So again, there are no coincidences in life, and the charities have really actualized what I think is important and has provided the finances to make it happen.
Had there been a model for high school-based clinics before?
There had been a traditional model that was applied primarily in elementary and middle school. And the model, while effective at that level, really needed some tweaking for adolescents in general and for high school specifically. And what I'm referring to is that while adolescents do need well child and sick child, they also require some assessment and evaluation of reproductive health. The previous funding for school-based clinics deliberately, from the federal level, excluded any funding of what we call birth control, screening for sexually transmitted infections, screening for HIV, and pregnancy care. And in fact, legislation for the CHIPS, the Children's Health Insurance Program, also did not provide those services. And if you think about what adolescents need, they need those value-added services during their teenage years so they can stay in school, make informed decisions, avoid risk, graduate from high school, and hopefully go to some sort of secondary or higher ed.